Hi everyone. Today we are going to study about pacemaker. It is one of the most important therapeutic device used in cardiology. Before understanding about the pacemaker, we should know how the heart normally beats. In human heart, it has its own electrical conduction system. Normally, the heartbeat starts from the SA node, that is sinoatrial node, which is known as the natural pacemaker of the heart. Okay, the electrical impulse travels to the atrioventricular node, that is from SA node. That the signal impulse pass through the AV node, then the bundle of his, then the bundle branches, and finally the Purkinje's fibers. This causes heart muscles to contract. Okay, this whole process gives a single pulse of a heart. Okay, a healthy adult heart beats about 60 to 100 times per minute. Sometimes this electrical conduction system fail, the heart becomes too slow, irregular, or maybe even stop temporarily. Okay, in such cases, an artificial pacemaker is implanted to maintain a normal heart rhythm. Okay, so SA node is known as the natural pacemaker. That means the artificial pacemaker is also known as the artificial SA node. Okay, so for the SA node, we can replace the pacemaker. Okay. Then a pacemaker is a small electronic medical device that generates electrical impulses to stimulate the heart muscles. Whenever the natural heartbeat becomes too slow or irregular, its main purpose is to maintain an adequate heart rate and ensure proper blood circulation to the whole body. Okay. So the principle of the pacemaker, that is, the pacemaker works on the principle of electrical stimulation. Okay. Based on the principle of electrical stimulation, it continuously monitors the heart's electrical activity. Whenever it detects that the heart rate fails below the programmed limit or no heartbeat is present, it delivers a small electrical pulse through the leads to the heart muscle. This electrical pulse causes the myocardium to contract and produce a heartbeat. Okay. Thus, the pacemaker only stimulates the heart when necessary. Okay. No, all the time the pacemaker stimulates the heart. It stimulates the heart whenever the heart needs the electrical impulse. Okay. Whenever the heart fails to produce a normal heart rhythm, the pacemaker produces the impulse to start regulate the heart rhythm. So the pacemaker contains the important components, that is battery. First, the battery, it provides the electrical power to the pacemaker. Usually it's made of lithium iodine. Okay, battery life around it comes under 8 to 15 years. Okay, next, first one battery, the second one pulse generator. Okay, first one battery, from that battery the electrical impulse generates. Okay, so the pulse generator generates the electrical pulses, controls pulse amplitude and the pulse width. Okay, then the control circuit, it acts as the brain of the pacemaker. Okay, the control circuit acts as the brain of the pacemaker. It monitors the heart activity and decides when the stimulation is required. Okay. Output circuit, it sends the generated pulse safely to the heart. Finally, the leads, that is electrodes, it insulated wires connecting the pacemaker to the heart. Okay. It carries the electrical impulse to the cardiac muscle and sends a natural heartbeat. Then the construction of a pacemaker. The construction starts with a titanium casing. The titanium casing protects the electronic components from body fluids. Okay. Then the battery supplies long-term energy. Then the circuit controls. The works of the circuit control is pacing and sensing. Then the leads deliver the electrical impulses. Finally, the electrodes remain in contact with the heart tissues. Okay, the pacemaker continuously senses the heart rhythm. If the heart beats normally, the pacemaker remains inactive. Okay. If the heartbeats become slower than the programmed value, the sensing circuit detects it first. Okay. Then the control circuit activates the pulse generator. The pulse generator sends a low energy electrical pulse through the leads. The myocardium starts to contract. The heart pumps blood normally. Now, when the impulse starts to produce the pulse normally, the heart pumps the blood normally. This process repeats continuously. Modern pacemakers work automatically, okay, and adjust pacing according to the patient's activity. If the patient go for jogging, according to that, the pacemaker produces the impulse. So there are various types of pacemakers. That is 6 type of pacemaker. The first one is temporary pacemaker. Temporary pacemaker, the word itself gives the meaning. It only used for a short duration. Okay, the commonly used after the heart surgery or during emergency treatment. The temporary pacemaker is after the treatment. The pacemaker will remove from the body. Okay, the next one, the permanent pacemaker. It implanted permanently under the skin near the clavicle. And used for a chronic heart disease, most commonly used everywhere. The third one, single chamber pacemaker, that leads to one lead. Okay, placed either on the right atrium or right ventricle. It is simple and economical. The fourth one is dual chamber. It provides 2 leads, one in right atrium, one in right ventricle. Maintains coordination between atrium and ventricle. Fifth one is biventricular pacemaker, that is CRT. Okay, it provides 3 leads used in heart failure patients, improves pumping efficiency, like that. Okay. Finally, the sixth one is rate responsive pacemaker. It can sense as automatically increase heart rate during the exercise. Okay, by this pacemaker, it returns to the normal during rest. Indications. Okay, when pacemaker is named. Okay. Pacemaker is indicated in bradycardia, complete heart block, sick sinus syndrome, arterial fibrillation with a slow ventricular response, congenital heart block, and heart failure. What are the advantages in pacemaker? It restores the normal heart rhythm. It improves the blood circulation, reduces dizziness, fainting, etc. symptoms, improves exercise capacity, increases the quality of life, long battery life, and reliable operation. So what are the disadvantages? It is a surgical implantation irrecoverable device. Okay, battery replacement after several years. That means after 8 to 12 years, the battery must be replaceable. Risk of infection, lead displacement, expensive, very expensive. Electromagnetic interference in rare cases. So what are the applications in pacemaker? Pacemaker are used in cardiology department, emergency medicine, ICU, cardiac surgery, treatment of chronic bradycardia, heart failure therapy, etc. Okay. What are the precautions for the patients? Avoid strong magnetic field, attend regular follow-up visits, carry a pacemaker identification card, inform doctors before MRI or surgery, avoid placing mobile phones directly over the pacemaker. Okay. What are the recent advances about pacemaker? Leadless pacemakers are available, MRI compatible pacemakers, wireless remote monitoring, rechargeable pacemaker, AI enabled smart pacemaker. These are working in process. So finally, we can summarize the topic. A pacemaker is a life-saving, implantable electronic device used to maintain a normal heart rhythm. Okay. In patients with conduction abnormalities, it continuously sends the heart activity and provides electrical stimulations whenever necessary, helping patients live healthier and more active lives. Okay. So once again I am repeating the whole content. A pacemaker is a small implantable electronic device that delivers electrical impulse to the heart when the natural heartbeat is too slow to or irregular, helping maintaining a normal heart rhythm. The normal cardiac conduction means SA node produces the impulse, then it passes through a V node, through the bundle of keys it reaches bundle branches, and through bundle branches it reaches Purkinje fibers. Okay, this is the whole process of the production of heart impulse. Okay, the pacemaker continuously the principle is based on the electrical activity. Pacemaker continuously monitors the heart's electrical activity. If the heart rate fails below a present value or beat is missed, it generates a small electrical impulse that stimulates the heart muscle to contract. So the main components in pacemaker is battery, there is lithium iodine, pulse generator, control circuit, then LEDs, then finally the titanium casing. Okay, the working of the pacemaker, it was initially detects the heart's electrical activity, compares it with the programmed heart rate. If the heart rate is too low, it generates an electrical pulse. Pulse travels through the leads to the heart. If the heart contracts and maintain normal rhythm. What are the types in pacemaker? That is temporary pacemaker, permanent pacemaker, single chamber pacemaker, dual chamber pacemaker, biventricular pacemaker, that is CRT, rate responsive pacemaker. So what are the indications that we need for a pacemaker? Bradycardia, heart block, 6 sinus syndrome, heart failure, congenital heart block. What are the advantages? It restores normal heart rhythm, improves blood circulation, reduces dizziness and fainting, improves the quality of life, long battery life. The disadvantages are require surgery, battery replaceable after several years, risk of infection, lead displacement, and high cost. Okay, finally the application: cardiology, ICU, emergency, cardiac surgery, treatment of rhythm disorders. Okay. Precautions. What are the precautions to be followed? Avoid strong magnetic field and to regular follow-up visits. Carry a pacemaker identification card. And finally, inform healthcare providers before MRI or surgery. What are the recent advances? Recent advances, that is leadless pacemaker, MRI compatible pacemaker, remote sensing or remote monitoring pacemaker, AI enabled pacemaker. Thank you.